My name's Anson Daine. I'm a registered nurse. I work in the pediatric intensive care unit at UCSF Benioff Children's Hospital in San Francisco. I've been working there about 2.5 years, so I'm a relatively newer nurse. UCSF has a pediatric pulmonary hypertension program, but within the last year, it's kind of greatly expanded, and my role, just working in the pediatric intensive care unit, our unit has expanded to accept patients who are kind of maxed out on their oral therapy and have kind of come to UCSF to see if they're candidates to start a subcutaneous infusion of some additional medication to see if that can kind of provide a therapeutic benefit. And some of the patients that we see, they've kind of been treated at some outside hospitals and they're coming to us. Many of them are very, very young, many under 1 year, and may or may not have even left the hospital yet since their birth. So we also see a lot of kids for whom, they've known nothing but the hospital for their life. Their parents have known nothing of kind of a home life with these kids. So in addition to getting them set up for success, kind of just on their new pulmonary hypertension medications, it's also kind of prepping them for success, taking their child home from the hospital for the first time, which obviously with any sort of chronic illness can be scary, and with pulmonary hypertension, kind of given the risk factors involved, there can be a lot that we kind of need to discuss and kind of prep the parents for. While everybody's different, some of the themes we see, especially parents for whom this is their first and only child, they don't know a different version of parenting. Their only parenting experience has been in a hospital and sometimes only in an ICU. They've transitioned from a neonatal intensive care unit to the pediatric ICU. I think with that, you lose out on some of the normal, quote unquote, bonding experience that you might have with your kid. And I think some of that sometimes gets replaced. They've become focused on a lot of the medications that their kids are in. But at the same time, while it is an ICU, one of the things I enjoy is that you can have a child who maybe has a tracheostomy and has other things going on in addition to all their medications. And it's exciting. They have spent their entire life in a hospital to have that first experience where you take them out of the bed and you put them in a wagon and you pack all of their medical complexities and technology onto a radio flyer wagon and pull them around the ICU for the first time, and just to kind of see the experience of them being out of bed, which is really exciting, especially if they've never known anything but that. Even the children who have spent most of their life in a bed or you're on a mat on the floor, uncharacteristic of normal childhood development, you still walk over the crib and you can get the huge smiles and the playfulness where you come in and you want to take your stethoscope and listen to them breathe, but all they're focusing on is your badge that's hanging off your scrubs, and they start playing with that in kind of characteristic child fashion. Or you're trying to do all of this medical stuff, but they're, as a 1-year-old, oblivious to all of that, and they are just focused on the normal kid stuff. They want to play, they want to smile, they want to blow raspberries at you, despite all the medical complexities and all of the kind of medical technology that surrounds a very sick child in an ICU. In the end, sometimes it's just a child in a crib, and there's some normal childhood things that just entails, and that can shine through and kind of supersede so much of the technology that we may surround them with. I think from the nursing perspective, we often talk about the fact we work 12-hour shifts. And so when you're with your patients for, 12 hours, the doctors are going to come in intermittently throughout the day. You're going to see the social work and child life and all of that. But at the end of the day, it's the nurse and the parents who are by the child's side for probably the most extended period of time, especially when they're in the ICU and they're under such close monitoring. The nurses are kind of in conjunction with the parents are going to be the ones who watch the child so closely and do that close monitoring that you kind of start to be able to pick up on those subtle changes. With the parents, you kind of see when things are maybe starting to turn, when children are either starting to get worse, but also you can see when they start to get better, when the therapies that they've come into the hospital for are actually starting to improve. They're starting to smile more, they're interacting with their parents, and that's such a rewarding experience to kind of see everything we do and all of the intensive therapy that goes in for caring for these sometimes delicate children to kind of really turn the corner and let them be kids. It's always an exciting time when the kids are transitioning out of the ICU, because it's such a huge step when dealing with such a illness that can put kids in such a perilous situation. I'm Anson Daine, and I'm aware that I'm rare.